Hi, I'm Aaron Dorfman, and I'm a pediatric cardiologist here at the Children's Hospital of Philadelphia. I do predominantly outpatient pediatric cardiology in our Voorhees and Mays Landing specialty care centers. I also read pediatric echocardiograms or ultrasounds of the heart at the main hospital in Philadelphia. The reason why I became a pediatric cardiologist sort of goes back to when I was a kid. I was one of these kids that from the time I was about 8 years old knew I wanted to be a pediatrician. I love working with kids. I love working with families. As I was going through medical school, I sort of knew that I wanted to do some type of pediatric specialty. I wasn't quite sure whether it was going to be eyes or hearts or lungs. But the day I learned about complex heart disease as a second-year medical student, my whole life was changed. I knew that there was nothing else that I could possibly do. The concept of very complex heart disease that up until the 1950s, 1960s, there was nothing that we could do about. And then over the course of the last several decades, have had a complete change where we have a variety of interventions and surgeries that completely changed the lives of these patients who now do absolutely wonderfully and live long, healthy lives. It was just completely mind-boggling to me. From that day forward, I was absolutely sold, and the more that I got ingrained in pediatric cardiology, the more excited I became about it, and the more fun I've had doing it. My favorite thing here about the Cardiac Center are the people and the families. I have to say, within the Cardiac Center, we're just extremely blessed in that we have a wide variety of experts in every field that we could possibly need. We provide excellent comprehensive care to all of our patients and families, from those with the most complex heart disease to some of the more straightforward things that we see on an outpatient basis that are not associated with particular complex heart disease. And I have to say, we have a team of physicians, nurses, administrative staff, everybody who works together to really provide wonderful care for our patients and families.